people, in this video, let us look at the complications of peptic ulcer. So what can happen if there is a lot of peptic ulcer, right? So basically, it usually heals itself. Sometimes it heals itself without causing any problem. But if these are chronic and they are large and they are deep, they can result in complications like obstruction, hemorrhage, perforation and malignant transformation. So let us look at these 4 complications of peptic ulcer. Basically, let us look at obstruction now. Obstruction means what can happen? There can be a pyloric stenosis or a duodenal stenosis, right? So where do you think the pyloric stenosis will be? Somewhere here. So there can be a pyloric stenosis, there can be a duodenal stenosis because of fibrous scar, okay? And even there can be, in this lesser curvature, there can be hourglass deformity due to fibrosis and contraction. So this is the hourglass deformity. Do you know how an hourglass looks? Something like this. So you can see how the lesser curvature has become like an hourglass. There's hourglass deformation of the stomach. So this is all the obstruction. What and all you will write here in obstruction? Pyloric stenosis, duodenal stenosis and hourglass deformation. Okay. So basically that is the first problem because of peptic ulcer. Let's move on to hemorrhage now. So there can be bleeding, right? Obviously minor bleeding means okay fine, there will be some occult blood in stool, but severe bleeding can cause anemia, it can cause melena, right? There can be, it can even penetrate into a major artery, and there can be massive hemetemesis can be there. That means vomit, blood and vomit, and even death can happen because of hemorrhage. So in hemorrhage, what and all will you write because of peptic ulcer? Minor blood bleeding can happen, like there can be blood in stool, etc. Severe bleeding can lead to melena, coffee ground vomitus, right? Coffee ground vomitus, what do you think? It is kind of old blood, right? And if it penetrates a major artery, like a gastric artery or a splenic artery, it can cause severe hemetemesis and even death, okay? So that was about hemorrhage due to peptic ulcer. Then coming to perforation. So the abdomen, so basically it can, this peptic ulcer can become so deep that it can become a perforation, correct? And this will be an acute abdominal emergency. Can you imagine this? It can become an emergency. So basically, on perforation, the contents can escape, from the stomach. It can escape into the lesser sac, right? From the lesser sac, it can escape into the peritoneal cavity. It can cause peritonitis, acute peritonitis. There can be air under the diaphragm because of air can escape from the stomach. So what and all is escaping the stomach? Air can escape the stomach. The contents of the stomach can escape and cause peritonitis. Subphrenic abscess can be there, and then there can be some other organs which are around the stomach can get involved, like liver and pancreas, okay? So all this is because of perforation. Guys, did you understand perforation? So perforation is one of the complication of peptic ulcer, okay? So here what can escape? Any content of the stomach can escape, cause acute peritonitis. Stomach air can escape and cause air under the diaphragm. Subphrenic abscess between the liver and the diaphragm can be there, and it can develop due to an infection. Adjacent organs like liver and pancreas also may get involved. Moving to the last one, malignant transformation. A very rare chance that it can become malignant. Just 1% of chronic gastric ulcers may transform into carcinoma. So that's it. We are done with the complications of peptic ulcer, guys. So peptic ulcer, what are the complications? Obstruction, hemorrhage, perforation, malignant transformation. Okay. Under this, there are a lot of keywords that you have to write. Obstruction, you will write what? Pyloric stenosis and duodenal stenosis, hourglass deformity. Then what will you write for hemorrhage? Hemorrhage, you will write blood in stool. Then severe, if it is severe, what will happen? Melena, coffee ground vomitus. Then if it penetrates a major artery, severe hemetemesis, death. Perforation, it can cause, it can be an emergency, acute peritonitis, air under diaphragm, subphrenic abscess, then involvement of the adjacent organs like the liver, pancreas. Malignant transformation, guys. Malignant transformation, very rare, just 1% chance. Okay. That's all for now under peptic ulcer complications. Bye-bye.